Our project involves forecasting, inference, and policy optimization to track coronavirus propagation at the county level. Gaps in existing solutions exist. For example, the limited publicly available forecasting does not show variations at the county level, instead being at largely the state level of cutting-edge forecasts. We would like to reduce that level of granularity as additional test data becomes available and county level information can be exploited. As you can see in the figure below, the hotspots in New York do not apply to upstate regions, which will experience peaks significantly later in the summer. Policy recommendations need this type of information in order to better optimize hospital capacity and sharing agreements across the state. Daily forecasting is also needed, which is a shortcoming of existing academic studies that only provide a snapshot. Limited public modeling tools exist, especially within the Python ecosystem, which is why we'd like to provide an open source solution to modeling. We're introducing here PySeer, which provides compartmental forecast models set up for coronavirus. The model moves patients between buckets of susceptible, exposed, asymptomatic, or symptomatic, with symptomatic patients flowing into hospitals and eventually death or recovery, and asymptomatic patients being contagious but recovered. Asymptomatic and hospital categories represent novel innovations in coronavirus modeling and allow us to track hospital utilization. Here are some of the example outputs from PySeer. In the top left, we see the implications of no distancing measures being taken, which results in a sharp peak that exceeds hospital capacity substantially. Instead, if social distancing is implemented, as in the bottom figure, we can significantly reduce the death count because we've reduced the level of saturation of hospitals substantially. We also predict mortalities due to saturation of hospitals, including ventilator shortage, hospital bed, and ICU shortages by county. We would like to model age-structured dynamics, which is in the works, county commerce interactions based on census data, and true COVID test coverage fraction estimates, which use proximity to test centers in order to estimate the fraction of untested coronavirus cases. One of the main features of PySeer is the ability to generate optimal policies which minimize the amount of deaths. Rather than flat policies, which are generally produced in academic papers, we've tried to machine optimize this in order to reduce the total death count, and you can see that the dynamics of the model are exploited in order to do this. Our next steps are to continue to couple this with county level data so that we can produce daily updates for each county as new data flows in. We'd also like to partner with local governments and university teams in order to put this model into the hands of modelers, and add localized Bayesian inference methods so that things like the local reproduction number in a county can be measured. We also are partnering with Unicast, who's generously shared their data in order to measure the efficacy of social distancing policies at the county level. If you can use this data or these models, or if you'd like to contribute, please contact us at the links below. Thank you.